in Greater Manchester. Well, that's good that it's been recorded. There we are. Just to say, Great Homes for Greater Manchester is about how to deliver better homes for the people who live and work in Greater Manchester. It's a coalition which brings together the voices from across the housing sector, influencers, decision makers, to get behind the delivery of Greater Manchester's mayoral ambitions. We want to build collaboration, consensus, and share and plan how best to deliver homes and places Greater Manchester needs for today and for tomorrow, more importantly. The pandemic, which we're still living through, and we started this conversation last year. I think it's probably one of our first meetings online. And again, it was very much then about how living at home and the issues and how that had highlighted the problems in social care and the inequalities which prevail in social care and supported housing. I think it's also, the pandemic's also exacerbated poor health generally and the need for quality care and support. I worry about bottlenecks and what's to come when it comes to the actual lack of quality social and affordable social care. I think there's already a shortage, and getting the right kind of social care is so fundamental to getting social care done. It is time for local and national governments to place health and well-being at the heart of housing policy as we emerge from the pandemic, which just seems to me, I was absolutely worn out by the pandemic myself, and hopefully move into recovery. It's clear the demand for better models of supported housing and living has never been greater. So today's session will look at how Greater Manchester can lead the way and deliver innovative new approaches to support those in vulnerable circumstances and build back better social care and supported housing. And I just want to say that last year we held the sessions, a whole series, and we came up with an action plan for Greater Manchester. And today's session is really to move on that debate. And I'll just refresh everybody's memories from our report, which was making the vision a reality. But we called on government specifically to support a better deal for social care and invest in innovative supported housing to deliver specialist homes, a healthy home for all, and better models of housing for an ageing population, including new models of intergenerational living in mixed communities rather than silo schemes, in particular to support those who need care to live independently, either in their own homes or by moving into quality adapted housing designed to support health and well-being. In addition, the Everyone In Rough Sleepers initiative needs to be sustained to ensure that the most vulnerable in society receive the support and the care they need. So that's what we asked for last year. And nothing's really changed, really, in the sense that we do have work going on at the GMCA. Steve Fyfe will give us an update. And I think the tripartite agreement that we have in Greater Manchester is also something which we need to recognise as distinctive and certainly a step in the right direction. So on our agenda is going to have a really good interactive discussion. Really pleased that we've got such an excellent lineup. We've got Lord Best, Richard Best, who is known to most people, I think, not least because of the Affordable Housing Commission and his stalwart support, and formerly, apart from being in charge of the JRF, and I go back a long way with Richard to the National Housing Federation, or it was actually the National Federation of Housing Associations, I think, when you were in charge. But so we've got Richard, so welcome as always. We've got Charlie Norman from Greater Manchester Housing Providers, but also from Mosscare St Vincent's, Chief Executive there. We have Steve Fyfe, who's the lead from the GMCA, and we're joined by two excellent MPs who know what they're talking about on this subject, not least Barbara Keeley, who's member of the Health and Social Care Committee, but is a stalwart and champion on social care, and of course from Manchester, and Andrew Gwynne, who again is the chair of the Greater Manchester APPG. So I think that's probably enough for me, and I think it is a very good session we have. Ultimately, the question is, how can we build back social care and supported housing in Greater Manchester? There are others looking at how we can drive that innovation. What does social care and supported house look like in Greater Manchester, and what can we learn from the pandemic? And are Greater Manchester's housing plans fit for purpose? Or do we need to reimagine how we design and deliver social and supported housing? I think, again, we probably do need to think about that in light of the pandemic. And if I am right, that there's a bottleneck. And also that whole thing, we're lucky in Greater Manchester because we do have additional powers. Maybe we can do more and do things differently in Greater Manchester. So that's enough from me, and I'm going to now introduce the wonderful panel. I've got Barbara, you to go first to give us your thoughts on where we do go from here and how you think we can build back better social care and supported housing in Greater Manchester. So Barbara, I'm really pleased that you're here.
Thank you, Gill, and thank you for inviting me to speak at this important event. Our aim in this session, as you've just said, really is to look at how Greater Manchester can lead the way and build back better social care and supported housing. And I'm going to start by looking at social care. As we know, since March 2020, more than 30,000 residents of care homes died from COVID-19, often unable to access the hospital treatment which may have helped them, or to see friends and loved ones at the end of their lives. And on top of that tragic number is thousands more who will have died of unrelated conditions, or because pressure on the NHS meant they were unable to get the treatment they needed. Now, care homes are places of communal living, and it proved problematic in the early part of the pandemic to protect older people living in care homes. Each of their deaths is a tragedy, but in policy terms, we need to rethink the use of care homes versus supporting people to live independently. In recent years, Age UK has highlighted the development of care deserts in the UK, places where it is difficult or impossible to get access to good home care. More than 1.4 million older people are living without their care needs being met. This and a lack of appropriate housing mean that many old and disabled people feel they have no choice but to move into a care home, even when it might be possible for them to keep living independently in their own homes. We've long recognised that communal living centres like care homes are not always the best option for older people or disabled people. This was definitely the case in the COVID pandemic. Going back as far as the 1980s, we recognised the importance of community support for disabled people and for people with mental health conditions. Now, while there have been some moves towards promoting independent living, the reality is that only Labour in Scotland introduced the free personal care system, which prioritised keeping people healthy in their own homes. Instead, our current social care system in England waits until someone hits crisis point to intervene. And that, combined with the widespread shortage of accessible or adaptable housing, is the problem. It means that people don't get the support they need to keep them safe at home, and they often end up in hospital as a result. After that point, discharging them back into an inaccessible home is seen as unsafe, so care homes become the only option. Fixing this will need reforms to the social care system, but 4 years after the government dropped their own proposals from the Care Act, we're still waiting for them to bring forward new proposals. Now, it is rumoured that the Prime Minister Boris Johnson is looking at going back to the Gill not cap on care costs, which we have already legislated, and that would be a welcome move because catastrophic costs for care are a serious part of the problem. But that in itself would do nothing to develop the supportive social care services we need to enable people to live in their own homes. We need reforms that expand access to social care services. Over the past 5 years, we've seen fewer older people receiving care every year as the eligibility thresholds have crept up in response to budget pressures on local authorities. Preventive care is increasingly uncommon, and as I say, intervention mainly comes after some sort of crisis. Rather than providing low-level support to enable people to continue living independently at home, we're increasingly providing care only once there is no prospect of someone living independently anymore, and that's not good enough. People should not see their horizons limited solely because they need social care. But with budgets under ever-increasing pressure, money for anything other than the basics of care is rarely available. Of course, there is a better way to deliver social care than 15-minute care visits, and people should not have curfews on their lives because care is not available in the evening. As well as funding care properly, we could embrace the spirit of the Care Act 2014 and ensure that care packages meet people's social and emotional needs as well as physical ones. That kind of person-centred support would enable more working-age disabled people to be productive members of society, and it would support older adults to enjoy their later life. At root, social care should be about supporting people to live happy and fulfilled lives without facing financial ruin. For many people requiring social care, it would also mean a presumption that they will be supported to continue to live independently rather than being forced into a care home. We are now told to expect social care reforms to be published this autumn, and I'm not optimistic at the moment that the reforms will go beyond the cap on care costs and will have the level of ambition which is needed. So if they don't, we'll be stuck with that system where our current lack of suitable housing forces people into care homes. And just a quick look at the numbers. I mean, we know obviously, and it's a cause for rejoicing that we have an aging population, that people are living longer, but that does mean that the housing stock is often unsuitable for their needs, and there's a growing shortage of supported housing. I'm sure we're going to cover this, Gill, in the rest of the session today. The 85 plus age group, if we remind ourselves, is the fastest growing in the UK population. It's set at least to double by 2050 and to treble by 2070. And in Greater Manchester, there's an estimated need for 15,000 extra supported accommodation units for older people by 2035. I just want to say briefly, I know it is possible to build high quality, accessible housing for older and disabled people. In Greater Manchester, organisations like the Fed have already done this. They run the Heathlands Village Care Facility in Bury that provides a range of accommodation for 180 people with care needs. And having visited there, that's high quality housing which meets the needs of older people, supporting their physical health and their well-being as a whole. We need to do more to promote developments like this for all older people, not just those who need social care services. But we need local authorities to be funded so that they can provide the wraparound services which older people rely on, and that they can work with developers to ensure that housing development genuinely meets the needs of local areas. We have already seen in Greater Manchester that local government can and does deliver housing which supports people to continue to live independently. So one lesson we can learn from the pandemic is that we should not let a combination of lack of suitable or supported housing, lack of access to care and financial pressures push older people into care homes rather than living independently. We must argue for reforms that tackle these needs and take the initiative in delivering the support and care that people need.
Yeah, and thanks very much for that, Barbara. I mean, I think you've kicked off the session really well there. I mean, I think, you know, from a personal perspective, I think from from seeing how it works with my mum, it's just what I find is this. I know the government's health and care bill, but the integrated bit doesn't seem to work very well between health, from hospital to health and then to home. And I think it is just a real conundrum. I think the point you made around that 85 plus and the older community, I think there's also that thing that, you know, every one size fits all when it comes to supported housing, and it just takes away often, I think, the actual personality or the actual human side of care, that, you know, you're sort of labeled 85 plus and you're old and therefore and that's the kind of sort of thing, those are sort of things that you would like to do, like you know, my mum's never played bingo or bridge, but it's that sort of thing of like, well, what do they actually want to do? And I think that thing around the personality gets lost. And I think how people want to live and the choice is just under so much acute pressure. I'm lucky because she can afford care, but for so many others, it's just absolutely, chronic. And I think, as I fear, that whole demographic is working against making that situation better. So that's me. Sorry, that's a personal thing. But thanks for that and setting the context. So now, Lord Best, if I can bring you in as well. I mean, thinking about successive governments' failures as well to actually tackle this, and also the longer term crisis which Barbara's sort of set out. But again, looking at the big question, what can we do to build back better social care and supported housing? Richard, and you're on mute.
Thanks, Gill. I think I won't do central government because today we're not going to change the minds of central government. I absolutely agree with everything that Barbara said. That's really good exposition. I'm just going to talk about what Manchester might be able to do, because we are putting a lot of faith in Manchester getting things right that other people haven't been able to get right. You have this real tripartite opportunity of bringing together health, social care, and housing, and this is a missing equation. So we're so many other instances. I chair the all-party parliamentary group on housing and care for older people, and our sort of slogan is there are three legs to the stool. There's health, there's social care, but there's housing as well. And if you don't have the third leg of the stool, it falls over, you're finished. And Barbara spelt out the reasons why housing can make such a big difference, prevent things going wrong in the first place. No point in sending people home from hospital after they've had an accident if that's where the accident happened. No point in sending them home if it's cold and damp back at the home. And Barbara emphasized that nobody wants to be in residential care, in communal living, in an institutional place. This is not the solution that any of us want. So what do we need to do? We need to create more new homes. That's number one, that are specifically and exclusively for later life, for retirement housing. And when we do that, of course, we do free up every time a house somewhere else. So we get 2 for 1. It's incredibly good value. And also the NIMBYs don't attack us so much for building for older people when we want to build on a fresh bit of land. But the opportunities for building new should really be taken. I have seen in Manchester 1 or 2 infill schemes, which I've really enjoyed, where 12 bungalows replacing those ghastly garages that no longer they've probably never had a car inside them, on estates, where people who don't want to move away can see the place that they can move to. It's really close. A retirement home. This is not the full extra care with care on tap. This isn't the whole full McCoy, but this is an extraordinarily good use of everybody's investment to build on the estate, the homes that are exclusively for older people, and keep them in that community. But so important too for people stuck out in the suburbs who are lonely, perhaps bereaved. We now recognize how important it is to combat loneliness, the mental health side of health and well-being. That's now a really big issue. And bringing together people in a place where they can get companionship, make new friendships, won't be alone. This is important, as well as the physical aspects of being in a place that's accessible and without those stairs and steps, and indeed with extra care, has care laid on and other facilities. So what to do? I've got three sort of ways in which Manchester could be part of changing things. First, the planners. Combined authorities is very much about seeing the whole strategic picture for an area. And I think that we should be much more insistent that house builders, private house builders doing things on any scale, incorporate some homes that are exclusively for older people. This gives a better mix of, in age group terms on the new development, but it also actually builds out faster by having different streams of housing being built at the same time. And the house builders should recognize their responsibilities. They build, well, we're hoping to get 300,000 homes a year, aren't we? How many of these from the volume house builders are exclusively for the huge demographic of older people? Almost none. We rely on the McCarthy and Stone and one or two other relatively small firms. We built 7,000 homes in the year before COVID, exclusively for older people. 7,000. And we're aiming for 300,000 altogether. It's a pathetic proportion of the total. Back in 1990, it was 28,000, 7,000 in 2019. We've forgotten that because we did all that sheltered housing of yesteryear that now needs upgrading and improving, we've turned our back on the idea that you should be building a large proportion of what you do for older people. So planners making those requirements of Section 106 while we've got it and whatever new system we have in the future, making the planning system work for us, not least in getting schemes into the town centres, into urban renewal, the high street renewal. There are great opportunities there for an anchor scheme in which older people who don't move around, who aren't mobile and constantly on the move, can settle down and make the place a stable community. Second issue is the housing which Manchester does itself. And I was saying that I've seen some really good examples of small infill schemes. Manchester can do more, but of course, in partnership with the housing associations to build those extra care schemes. They are fantastic. This really works. Who wouldn't want, a really nice self-contained apartment with the other amenities and facilities and the opportunity to socialize built in around it? When you're moving out of somewhere pretty grotty, this means that your last 10, 15 years, whatever, are going to be good years, despite being that much older. And a third thing, support the care and repair, staying put, home improvement agencies, because these are a neglected part of the picture. And away from social housing and the relatively small numbers, we're going to, even if we do really well, it's going to be small numbers. We're going to need advice and support and guidance and hand-holding and encouraging to go down every street, everywhere. We're going to need people to be part of the movement to upgrade properties. The sustainability agenda is going to help here. It's a big part of not just job creation and economic revival, but of getting homes into good nick. And that opportunity, I think, means that just like disabled facilities grants in the past, we've got things like the Green Homes grant. That wasn't much COP, very badly handled. The Green Homes scheme didn't really work, but there's the homes upgrade grants, which are for people on lower incomes. And home improvement agencies are the people to be the intermediaries. How do you, as an elderly person in their own home, but it's only an £80,000 home, how do you, as an elderly person living there, how do you access, get your hands on the money, organize the builders? This is asking an awful lot. We need those agencies. We've neglected them and forgotten about them very largely, but they are really important key players, I think, in the future of getting things done and being part of this agenda which prevents things going wrong and keeps people within their communities for a happier old age. So, Gill, I think it's fantastic that there is a combined authority with a wonderful mayor raring to go that brings together these three elements of health, social care and housing. And I wish Manchester every success.
Yeah, well, thank you, Richard, as always. And I think that whole thing around having a strategy, but also bringing very much, and Andy Burnham does talk about healthy housing, and one of the few people who actually acknowledges how important health and well-being is. So, but who better really to give us an update to what the plan is, or that strategic vision, and ideas around innovation. But Steve Fyfe, who has got the very important title of Head of Housing Strategy at the GMCA. So I'm looking forward to hearing from you, Steve.
Morning, Jill, and thanks for the invitation. And I feel like we're going to be agreeing with each other quite a lot this morning. A lot of what's just been said, I would absolutely agree with, and hopefully we can live up to the billing from Richard and yourself in terms of our ability to translate some of this into action. But if I just give some context from a GM viewpoint, maybe just to add some facts along with the arguments that I think we're all well made in terms of evidence base. We actually did a census of supported housing in Greater Manchester a couple of years ago before the pandemic, because actually it was quite hard to know what was out there and what it was doing and who it was doing it for. And the outcome of quite a lot of work there was that we have around 33,000 units, to use the horrible word, of supported housing in Greater Manchester, around 3,500 schemes to make that up, and a whole range of people that are living in those units, hopefully decent quality and meeting their needs. But we know, having done some work using the methodology from the Housing Lin, that we're looking at around 25,000 additional units that we'd want between now and sort of 2035, 2030 or so. As Barbara mentioned, around 15,000 of those for older households, 1,500 or so for people with learning disabilities by 2031, 2,500 for people with mental health needs by the same period, 2,300 additional fully wheelchair accessible homes by 2035. Just on need, if you like. There are strong arguments that we should be doing more just to provide that variety in the housing stock. But just based on needs, those kind of numbers just in Greater Manchester kind of illustrate the scale of the issue. And I'm glad that people have picked up on the tripartite agreement, the partnership that we've got in Greater Manchester. We've got ourselves at the CA and the 10 local authorities. We've got Health and Social Care Partnership, and for us, really importantly, the GM housing providers, the Social Landlords Collective in Greater Manchester. We launched a formal tripartite agreement last year, and one of the issues that's central to that is the provision of supported housing. And for all the reasons that we've already talked about, the worry for me in a kind of housing strategy role is that supported housing is very often such a low visibility sector, but the importance of it in terms of quality of people's lives is just immeasurable in some ways, and Jill's personal experience, I think, just illustrates that. So I guess for me, there's two kind of, coming back to the policy side of things, two tensions, I suppose you would say, that are at the heart of the problems, of the challenges that we face here. One is around the tension between the long-term benefits and the short-term costs. So the funding levers that we've got and the sort of financial beneficiaries of this, if you like. So we know that investor save is something that the Treasury always talks about, but it does feel like a hard hill to climb with supported housing when the investor and the savers are not the same organisations. We know the public sector overall benefits, leaving aside the obvious benefits in terms of quality of life and independence and all the things that we've already talked about. But making that connection to justify and to build the case for that long-term investment is still hard. And part of, and a kind of related, I suppose, point is around the separation of capital and revenue funding here. So on the one hand, the capital funding, and Charlie will talk next, I'm sure, more eloquently than I can, but capital investment that a housing provider needs to put in with some grants and so on, based on a 25-30 year business plan, but dependent on revenue for the support services that can disappear in 12 months with very little predictability. And obviously, as local authorities, we do what we can to minimise those risks. But it is hard in a conversation with a housing provider. There's not a lot of guarantee that you can give them, even though the provision that you're asking them to help provide is absolutely essential, and we can evidence the need and all the rest of it. But what's the support service going to be? What's the funding going to be in 3, 5, 10 years time? it is very hard to predict. And then kind of alongside that, and particularly in areas like homelessness and rough sleeping, but not only, short-term bidding cycles means that it's hard to put together a scheme quickly and to hit the right quality and to make sure that you're providing the right stuff in the right place for the right people, while also doing the practical stuff like finding the site, finding the land, getting it through planning, all that kind of stuff. So it's not an easy business to provide new, but the case has been made strongly, I think, this morning, and we'll continue to do that. So from a GM point of view specifically, what is it that we're doing? So I've already talked about the evidence, so we can point to well worked through evidence about what we need and where and why. We've got the partnerships, the tripartite, those three legs of the stool. We also, I think, to be fair, work pretty well and pretty closely with Homes England, and there is some money in the new Affordable Homes Programme with a supported housing flag attached to it, so that's positive. We can do some stuff around public sector land. It's not an infinite resource, but it's there, and we need to do what we can. And we can also obviously help on the planning side of things, and the papers will be going out later today for the Joint Committee on the Places for Everyone plan. So that's moving on to the next stage. Underneath that, I think what we want to try and do is to move from scheme by scheme to a programme, to saying, here's what we want in Greater Manchester overall, and rather than doing it piecemeal, and that's perhaps an unfair accusation, but it does feel like every scheme needs to be justified from scratch, if you like, that we can put together a programme that says, here's a strategy, here's a list of sites, here's our partners that we're working with, and we can do this together as an ongoing piece of work. And then I guess finally some opportunities, because we do often depress ourselves with how difficult things are. I think Richard's very importantly pointed out to the town centre, district centre opportunity, if you like, that supported housing is an ideal way of responding to the challenges that our town centres are facing, bringing some life back into those locations. We do need some greater flexibility around grant to make those happen, because sometimes those schemes are difficult, more challenging, harder to put together. And the same, I guess, applies to renewal and redevelopment of existing schemes. So some of those are actually in ideal locations, but what physically and in support terms they offer is no longer what's needed. So an ability to be as flexible as we can to do more there would be great. Spending review obviously is looming. That point around long-term revenue seems to me to be one that should be pretty important and high in government's minds in looking at what they can do there. I also think, Richard, again, care and repair, home improvement agency, that's something that's been on our radar for a couple of years, and slightly stalled because of COVID, to be honest, but the points you make are absolutely right, and we need to get somewhere with that. On relatively little money, actually, you could make quite a big difference to a lot of people's lives, which again comes back to that investor save point. And then finally, for me, as a sort of housing strategy guy at the CA, there's an even more basic point that we need to deliver more homes for everyone, and this needs to be an important part of that. They need to be the right homes for the people of Greater Manchester, and a lot of the people of Greater Manchester do need supported housing of different kinds. So let's crack on with it, would be my message.
Fantastic, thanks, Steve. And I think it's so important to get that investor save, or get the economic argument or the economic benefits around supporting social care out there. You know, this is a matter really for government, as you know, nationally, to sort of say, let's not push it into, you know, this is too hard, it's about selling people's homes, but actually to sort of really put health and well-being and that sort of planning into care, and actually realizing that you can really do something by actually making sure people, you know, back into the economy. It makes sense. And I think maybe, you know, what you know generally need to do in Greater Manchester is begin to change the narrative to say what is possible. And I think the other point that's really important, and hopefully Great Homes to Greater Manchester can can help is to sort of bring that housing community together, from the planners, the architects, the designers, you know, to the builders, and all of those people together to really sort of say, well, this was what we can do. You know, we are where we are. But I think, as Richard said, you know, Greater Manchester does have probably the best chance of doing things differently, in the words of Andy Burnham and Paul Dennett, you know, and we've got hopefully the places for everyone coming out shortly as well. So we'll see what's in there. But I mean, it's really good to hear from you, Steve. And now, really, from a practical point of view, I want to bring in Charlie Norman, who you know, is really the Joe DiMaggio of Manchester on this, on this subject when it comes to housing provision. So I'd really like to hear what you've got to say, Charlie, and comment back on anything you've heard.
Thanks so much, Jill. That was an interesting introduction. I wholeheartedly agree with everything that Barbara and Richard and Steve have said, and I think what we do with this agenda gets to the heart of civil society and how we treat fellow human beings. So really happy to have the opportunity to speak, so thank you for that. My organisation, Mosscare St Vincent's, is part of 27 housing providers across Greater Manchester, and as Steve so eloquently put it, we're working together as part of the tripartite agreement with the CA, the districts and the Health and Social Care Partnership, and have been doing for a few years. My organisation's been going for some 50 odd years, and I know I've got a colleague on the call, Yvonne, who's in a similar position, and we have been trying our best to deliver supported and specialist and age-friendly accommodation for those 50 odd years, certainly at MSV, and it's getting harder. And I've got a couple of asks at the end of the discussion today, because we are trying to be really proactive about keeping the spotlight on this and keeping it on the agenda. So it's wonderful that we're doing this today. So the housing provider is 27. We provide 1 in 5 homes across Greater Manchester. We worked very hard with the CA and Health and Social Care Partnership to do this baseline on what is it we've got in terms of supported and specialist accommodation, and what do we need to do going forward. And I think we can articulate now really well some projections of what's needed going forward, and I know there's massive will and appetite to help to deliver that, but not one of us alone can do that. We're going to have to work on it together. The Marmot report a couple of weeks ago really sort of brought things home, didn't it, about health inequalities in Greater Manchester and health inequalities generally, and that's part of what we've been trying to do, working together. And we know that health should begin at home and stay at home and within the community, and you should be able to start well, live well and age well in your home, and be surrounded by a community that supports you. And 90% of a person's health and the wider determinants of their health are there and not in clinical settings. And the philosophy that we have is that, you know, everybody should have a decent, safe and affordable home. And Barbara said before, the opportunity to lead an independent or fulfilling life, and for some that will be housing with support or support in their own home. And I agree with all the comments that have been made about institutional care, and what we try and do is outside of institutional care. So last couple of weeks, I visited one of our schemes just to illustrate some of the work we're trying to do. And this is just MSV's work, but colleagues across the 27 housing providers are doing the same. I visited the depot site in Whalley Range on the border with Moss Side, where we've got a mixed use scheme of sort of shared ownership, home ownership and rented properties, but really importantly, an extra care scheme, which was handed over during the pandemic last year, which was really difficult. And met some of the residents who've moved in there who genuinely have reported that their health outcomes and their reliance on GPs and the support they're getting within the scheme. Some of them reported feeling like they've won the lottery and they've got a new lease of life, and it's just fantastic to meet them. On that same site, and we talked about intergenerational sites and best use of sites, we're building a happy scheme, and I think there's a big thing here about most people live in their own home and don't live in institutional care or supported or sheltered housing schemes. But a lot of people are trapped in their own home, And I know there's work on move or improving people's homes so they can live independently for longer, or helping people to move respectfully to really decent quality retirement living, and that's the Happy Principles. So we're building our 6th Happy scheme on that site, and that is the one that we built in Bury a few years ago. The people that moved into that scheme have just got this fantastic retirement living now, and moved out of 3 and 4 bedroom houses in some cases, which other families have moved into those homes, and that's part of the sort of like the right place for the right time of your life and the housing crisis being addressed. So just round the corner from there as well, we've got a foyer for young people, and we have talked a lot about ageing today, but as Steve outlined, this is a much broader agenda around supported housing. And that foyer is for 16 to 25-year-olds who are at risk of homelessness and have complex lives. And round the corner from there, we've got, we just done a deal with Manchester to provide some care leaver accommodation at Boundary Lodge. And just to illustrate the costs of the savings to the public purse, that when it's open, the care leavers move and care experience young people move into that scheme, it'll replace private sector care costs of up to £4,000 a week, and with an average cost of 500 for each of those individuals, so 4,000 to 500. Also great quality and really good outcomes. So as Steve has said, we've got a track record of delivering the schemes, often on 30-year business plans with lots of private borrowing. It's great that 10% of the Affordable Homes programme is being given over to supported and specialist accommodation, but I would only echo what Steve says, that has to be flexible, and it has to be higher grant rates to recognise the nuances and difficulties of delivering these types of schemes. And it's really good that we're talking about working more with the housing association sector, not for profit, and it's about people. And all of this is about people and people's outcomes. The case is made, so it's about independent living, less reliance on expensive institutional care, which is not good for individuals' outcomes. And I think we need to do much more to look to repurpose and look at the existing provision, but also we've got a massive commitment to build the new homes that we need and have that appropriate home for the person for their life. I've got 3 sort of things that I wanted to specifically ask, which are, one's about capital investment. Accessing that 10% of the Affordable Homes programme does require better grant rates. We need to be able to use that grant for repurposing as well as new build, and that's really important. And the other item that I wanted to talk about is adult social care policy and finance. And we've got very specific experience of this, which is where a scheme has been commissioned, built with a 30-year business plan, accessed grants, built in good faith, and then short-term commissioning and short-term thinking has rendered those schemes, we've been decommissioned in some cases. And what we're trying to do, working collectively across Greater Manchester, is to look at longer-term commissioning and better partnership arrangements to avoid that. I do think that local authorities obviously struggling with budgets, and there have been some horrendous cuts that have been made, and top slicing adult social care budgets is not helpful in the long term. So I do think we need to put a solid ring fence around revenue funding for support costs. The buildings can be delivered with higher grant rates and higher flexibility. The support costs need to be longer term funded and ring fenced and protected for individuals and their outcomes. And then there is the issue that Steve's raised about better use of public estate, not going for top dollar for estate and land, and better planning, and making best use of the assets that we've got to deliver the housing that we need for people, because as I said at the beginning, this gets to the heart of civil society. We've got an appetite to work together on this, and I do think we've got a really, really good opportunity here under the tripartite agreement to keep this alive and well. Thank you.
Thanks, Charlie, and I think, thanks very much for putting the asks there, because I think we can work on that and take that forward together. But now I'm going to switch finally to Andrew Gwynne, MP, who's going to give his views on how we build back better supported housing and social care in Greater Manchester, and then we'll start talking. So anybody wants to put questions or thoughts in the chat, please fire away. But Andrew, over to you.
Thank you very much, Gill. And the curse of going last is that a lot of what you want to say has already been said. Look, health and housing are linked. There's no getting away from that. And there was a reason why, when the National Health Service was established, Nye Bevan wasn't just the Secretary of State for Health, he was the Secretary of State for Housing and Health. And somewhere along the line, the two have become disconnected. But there is, I think, as Lord Best has said, a huge opportunity with the devolution programme, with the city regions taking on more powers in respect of health and housing, to start to piece this jigsaw back together. Because we know the solutions, and we know what's got to be done, because we've been talking about it for such a long time. Look, at the start of my political career 25 years ago, I was a Tameside councillor, and I was on the not very nicely named SPLAT committee, which was Strategic Planning and Transportation, and we did a big piece of work on lifetime homes, of how we should build in those standards to new properties that were built in Tameside, so that your doors are already wide enough to take a wheelchair or a buggy, that you've got the electric points, the plug sockets halfway up the walls, so you're not having to bend down, so that you've got the at least a cavity in the wall going up the stairs, if not the whole electrics put in, so that it's easy to install a stair lift if that's what you need. All those things we were talking about 25 years ago, and yet in many cases the homes that are still being built in Tameside and across Greater Manchester don't necessarily meet that ambition. We have to ask ourselves why, a quarter of a century after we were talking about these things, we're still not there. There's a huge challenge to be done. And why does this matter? Well, look, we're talking about people here. I'll give you an example of a piece of casework that I picked up on a door knocking session in Reddish about 4 or 5 years ago. And it was two people living in an adapted council house. It was a 4-bedroom house, and the two people that lived there were dad and daughter. Daughter is profoundly disabled. She's in a wheelchair. She needs a hoist to get her into a bed. She needs all kinds of specialist machinery to get her up the stairs, because the staircase isn't just a conventional straight up. It's one of those that goes up to a semi-landing and then turns back on itself. So the piece of track that they've put in wouldn't look out of place in Alton Towers. You know, it is a feat of engineering genius how this house has been adapted. She's doubly incontinent, so needs a lot of sanitary products. So the box room is literally a storeroom, and it is a box room. It's full of boxes. It's full of the sanitary products that she needs. But her dad has needs as well. He gets regular help from social care in Stockport. He needs a carer when he's taking his very heavy duty drugs, because it zonks him out. The carer's not for him, the carer's for his daughter. And they were on the point of being forced out of their 4-bedroom home because of government policy. Government policy's not joined up, because they were being clobbered by the bedroom tax, not for 1 spare bedroom, but for 2. Now, this property had cost Stockport Council £50,000 to adapt, a lot of money. And they were being offered a 2-bedroom flat, which wasn't fit for purpose, because there was nowhere for the carer, there was nowhere for the storage of all the sanitary products. And the flat itself would have to be adapted, probably costing another 30, 40, 50,000 pounds, and all that adaptation in the 4-bedroom property would have to be ripped out. Absolute nonsense. We got that overturned, but you know, it shouldn't have to take the involvement of a member of parliament. But that just reinforces to me why it is so important that the homes we build for tomorrow are fit for purpose for all eventualities, including for families like this. So enough of the talking, it's time to get on with the doing, and that is the challenge really for Greater Manchester. We know the number of homes we've got to build over the next 20 years. We know the design ambitions that we've got. We know the eco ambitions we've got. We want to build to the best environmental standards. We want to build lifetime homes that meet that independent living challenge, the supported accommodation challenge. We've got great public sector partners that are keen to do that, like the housing associations as well as the local authorities. We need the private developers to do their bit as well. Enough of just building these bog standard boxes. We've got to do better than that, and there is a huge role for the combined authority. But look, it's also about the dignity of the person in the home, and the fact that we want to build these homes for people to live in, if necessary, from cradle to grave, or at least be able to have suitable accommodation to move on into if the home isn't suitable at some stage in their life, as Lord Best has said, freeing up a perfectly good family home and providing that more adequate, better accommodation for those with specific needs. But it is also about the money, and there's no shying away from it. Until the government really puts social care as a top priority and intermeshes social care with future-proofing, with building decent homes that meet the challenges of an ageing population, of people with complex needs, of people living longer with comorbidities as well. And until they are really focused on tackling the health inequalities that are still endemic in large parts of Greater Manchester, we're just chasing our tails. So it is going to need pressure on government, but it's also going to need innovation at a city region level. The strapline for Greater Manchester is doing things differently. This is one area where we can do things differently, where integrating health, social care and housing and building better communities as a consequence is something that very much needs to be on the agenda of the city region, is on the agenda of the city region. And by working in partnership, public and private sector, I believe we can make great strides and show the government just what can be done when the powers are given to city regions, and with the resources and the political will can also be done across the whole of England. Thank you.
Thank you, Andrew, and thank you to our very brilliant panel. Every contribution has actually added to the other, and I think we've got a really good opportunity. I think that's clear in Greater Manchester to do things differently. I want to sort of open up the discussion to everybody on the call now to add into the debate, but I just wonder if there's any of our panel who want to come back on any particular points that have been raised. If so, do that. I just wondered, Barbara, if you wanted to reflect on some of the contributions as you started, and then I'm going to bring in some other points that have been made in the chat.
Yes, I just wanted to agree with what Andrew said. I was thinking back. I think the last time I saw really some really super lifetime homes was in sort of 2009 to 2010. The last ones that the local authority built in Salford, and they were super. And that, you know, there was a really sort of mixed accommodation in this new little street. You know, the people with needs, the sort of needs that Andrew's described, and you know, clearly that was a very happy setup. That now was 11 to 12 years ago, and we haven't, you know, as Lord Best outlined, we have not been building these units, and we absolutely have to learn that lesson from the pandemic, that we cannot just live with this situation where we don't have the supported accommodation that people need. I mean, I didn't I talked mainly about older people, but the same is true for people with learning disabilities. Nationally, we've got 2,000 people with learning disabilities and autism stuck in NHS inpatient units at a fantastic cost. I mean, Charlie talked about placements that cost £4,000 a week. That's not uncommon. It's just a question of channeling the money into the community and the right properties. And people don't have to live in those horrendous conditions that they're in. So, you know, right across the piece, you know, I think the panel has highlighted what needs to be done, but we've actually now got to really argue that this has to happen. We cannot carry on living with a situation that we know is so bad. And it is part of the issue that led to those 30,000 people dying in care homes, because we couldn't protect them. You can't, you know, it's not a hospital, is it? A care home. You can't isolate people, and in fact, you know, the sad thing, as many probably know, is that to isolate people, that came at a great cost too, because that meant people being stuck in their rooms and not able to see anyone, which is not desirable either. So I think we have outlined the major issues. Let's just take this and, you know, really impress on central government and do whatever we can in GM to take this forward, because it really is very, very important.
Yeah, thank you for that. And Yvonne, you've had your hand up and also been commenting in the chat, so I'm going to bring you in. I think you're the Yvonne that Charlie referenced as well. So yeah, so welcome.
Yeah, thank you very much, Gill. I'm really good speaker sessions, and Charlie and I do work close together with GMHP, and we are trying very hard. There's some great work that people are doing as a collective with some really good work streams in GMHP, which cover the tripartite agreement that Charlie's really pushed and made successful. There's also other things around technology enabled care, and that was part of my point. And I also wanted to add invisible creations to this, which are disabled adaptations that don't look like disabled adaptations. So when Andrew talks about lifetime homes, there's lots of stuff we could do much more of to build those lifetime homes with the technology enabled care in it, with invisible creations adaptations in it. So they are a home that support people as they change through their journey, and they don't have to move. And Gill, a lot of your points about people move when they're desperate, you know, that's such a bad place, isn't it? But there are things out there that can help us. I think the challenge we have, which is where Steve and Charlie really hit the nail on the head, is how we make sure there's long-term strategies and long-term funding to support that. So we've not got the balance of long-term capital, short-term vision on support, because that support, which could include these types of things, is absolutely essential to help people stay in their own homes with that dignity that people have talked about. So I just wanted to make that point, and also to apologise. I do have to jump off because I'm on an older person's conversation next, actually. But yeah, it would be great if we can weave that into the strategy that Steve talked about for GM.
Yeah, thanks very much, Yvonne. And again, I think it's that whole thing about having a long-term vision and, you know, confidence and really power to take that forward. So everything's livening up on the chat. I'm going to bring in Matt, if you're there, I can see you, because you made an interesting comment in the chat for a quick contribution.
Yeah, thank you, Jill. It just picks up on the point Yvonne was making in terms of the short-term commissioning and the really price-driven decisions being taken by commissioners. And I was just having a look whilst we're on the call at who are the partners in the Greater Manchester Health and Social Care Partnership, and we've got a very long list of NHS trusts, and there is 0 social care providers on that group, and there's therefore really a question of how is that voice being heard, who is making the points for actually long-term commissioning and the need for that for social care providers, and it seems to me that's a real gap, and I'm just interested in the panel's view on that.
I think maybe Charlie, you know the answer or have a view on that.
Well, I mean, if any of us has the actual answer to all of this, we've cracked it. But yeah, I completely agree, Matt. I think it's a fantastic point to make, and we've been having these conversations for so long now, and trying to understand the system and how the system might need to change, and that longer term commissioning has become a big topic of conversation, because the buildings and provision of homes and things like that, it's not easy, but it is one side of the conversation. The commissioning of support services is really, really difficult and challenging. And I think we all agree on this call, and I think it's absolutely shocking, and we started this at the beginning, which is that social care is often the poor relation, and it shouldn't be, and it's outrageous. So with that in mind, with the discussions we've been having about the tripartite agreement, and in particular about supported accommodation, we've very much started to talk to all the directors of adult social care who have a meeting. They meet regularly, the 10 DASs, and also directors of children's services as well, and we're having some really interesting conversations with them about how we can mutually support each other to get the best outcomes for individuals. So it's early days. It's probably been about 12 months now since we started those conversations, but I agree with you that they really should be represented in front and central in these conversations. So that is happening, and I think there is massive agreement that this all needs buy-in and longer term commitment and joint strategies, and we need to lobby central government as well for ring fencing of funds and that kind of thing. So it's really quite positive. Happy to share any further on that as well. You're on mute, Jill.
No, I've done it now. Okay, I'm going to bring in Andrew, because you've got your hand up as well. I think what I'm quite pleased, because one of the points about Great Homes Greater Manchester is that we actually showcase any innovation or really good ideas that are out there, but there's an idea sort of that we actually sort of focus in on some of the ones that are referenced today, and perhaps parliamentarians from the Greater Manchester All Party Parliamentary Group and others, and specifically we can begin to do some of that showcasing, I think, and also use that as a way of sort of demonstrating what Greater Manchester can do. But that might be for later in the year. But anyway, Andrew.
Yeah, thanks, Jill. It's just to come back on Matt's point, because I think he makes a really important point about the lack of involvement of social care providers in the partnership. Look, the Health and Social Care Act 2012 is an atrocious piece of legislation. It has fractured the health service and social care massively across England, and we need to piece that back together. There's likely to be another reorganisation coming. I'm not necessarily sure that we need a full reorganisation to get what we want, because some of that integration's already happening outside of the 2012 Act. I'm not saying it's perfect, but I've seen massive differences, positive differences in the Tameside part of my constituency after a series of unfortunate events. So we had a hospital that was in special measures, a new chief executive brought in. She was very keen to turn the hospital around, to get away from the perverse incentives of basically funding by bums in beds, but moving people back out into the neighbourhood. The new role for the Foundation Trust is to provide some of those community services in the neighbourhoods or in people's homes. That required cooperation and buy-in outside of the 2012 Act by the local authority and the clinical commissioning group. Now, the CCG was going financially belly up. The Secretary of State was going to come in and disband the Tameside and Glossop CCG. The local authority went to the Secretary of State and said, can we take over the CCG? So actually, Tameside Council is the clinical commissioning group. The chief executive of Tameside Council is the chief operating officer of Tameside and Glossop CCG, and the CCG board meet alongside the Tameside Council executive as a single commissioning organisation. That has meant that sharing staff, sharing resources, sharing budgets, you've actually got that proper joined up integration of primary care and social care. And then by them agreeing to commission the Foundation Trust, the hospital, as one of the main providers of community care, you get away from that perverse incentive. So you've got a single health economy across Tameside and Glossop that is properly integrated. And I just hope to God that with the reorganisation that's coming, that will affect the whole of Greater Manchester, that we don't throw the baby out with the bathwater in Tameside and Glossop, where actually proper integration, where NHS England have said, we're not looking because we know this sits outside of the 2012 Act, just make it work. They have made it work. There's still the issue of financing. There's still the issue of social care being chronically underfunded, but that integration is working massively well in Tameside and Glossop. We need more of that, not less of it.
Thank you very much. Barbara, is that a hand up that I saw? Yeah, I think the whole thing about integrated, and we've got the integrated care bill, I think this week, isn't it? The second one.
Yes. Yeah, it is. I just wanted to say, I mean, Andrew's quite right to highlight, and I know what's happened is that flexibility has developed despite the 2012 Act. And that's really good. And I think it's important for us now in Parliament that we don't want to throw away the progress that Andrew has highlighted that has happened in places like Tameside with rigid structures. That there is a concern that I've talked through with my CCG, that as we develop the ICS that's going to be a GM structure, that we don't lose what we developed in Salford, what we developed in Tameside, because and you touched on integration earlier, and we do have the Health and Care Bill on Wednesday, a second reading, but it hardly mentions social care. You know, obviously because we're all holding our breath for those reforms that I talked about. So there is a danger, and Matt's quite right to highlight it. There's a danger that the voice of social care is not heard. And that caused, you know, in great part, all of the problems that we've had with mortality in care homes, because it just wasn't understood. The people taking the decisions, the politicians and the experts advising them, did not have the voice of social care represented. There was nothing in the advisory structures to the government during the pandemic that represented the voice of social care. So we've even had admissions that we got from Matt Hancock, the former Secretary of State, that they didn't have, the department didn't have a list of care providers. Now, you know, the crazy situation. So that voice needs to be heard, and it's providers that also need to be represented in the partnership structures, because, you know, like it or not, the social care sector is privatised largely. It's not run by local authorities anymore. So let's hope we say that, and I'll be saying that loud and clear in Parliament, and I'm sure other parliamentarians will as well.
Yeah, I know you will, and I'm sure Andrew will pipe up as well. We've got a good team in Greater Manchester. So Charlie.
Thank you. I just wanted to come back on that integrated care bill. We have been discussing that on the sort of health and housing and GM Healthy Homes front, and very much along the lines of, actually we are ahead of the game. It's not by any stretch of the imagination done this, is it? But we are ahead of the game, and we don't want to lose what's been achieved in Greater Manchester so far. And I agree with you, Andrew. We've been doing some fantastic work in Tameside, particularly with care leavers. It's been amazing where barriers have just been removed to get the job done. So but what I do like about the integrated care proposals is that duty to collaborate, and the duty to collaborate, which is specifically spelled out in the new bill, is really good, because that is what we've been doing, isn't it, in Greater Manchester, and what we do so well and so differently. So I think that's really good. But what I was going to ask is if we can just keep a spotlight on this, and a spotlight on social care as equal partners with health, and that would be really great to see that represented in Parliament. And that sort of case, that invest to save case that's been made, you know, if we invest in things like the schemes we've talked about today, the longer term savings to the public purse, and more importantly, the impact on human beings and their outcomes is massive. And then I just wanted to raise that, I put it in the chat, that we can arrange some visits to some of the schemes that I think Andrew has agreed that you know, despite all the odds that have been delivered over the last few years, because I think it would be interesting. We're perhaps not doing enough, even with ourselves, to shine a spotlight on what some of these schemes and homes can do. So just to put that offer out there, Gill, thank you.
I think that whole thing around collaboration and working in partnership and actually bringing that argument together is going to be so important, and we do want to keep the spotlight. It is such an important, it's important to everybody, and I think that's one of the things that frustrates me when people talk about supported housing and social care, is that people think it is around old people, or it's just nothing to do with them, when actually it impacts on the whole family, and communities, and it's a much bigger issue. And if not now, at some point in your life, you will rely on some support, and you will want quality support, and it should not be that if you can afford it, then you're okay. It's a very interesting opportunity, I think, we've got now to really say this is a priority, and it can't be pushed into the too hard and too difficult, when actually probably in Greater Manchester we can actually point to really good thinking and really good examples where there have been cost benefits and everything. So that's enough of me. I'm going on my pet subject. Claire Brown, you've been quite active on the chat. Just wanted to bring you in, and just wondered if you had talked about the future home standard and other things. So again, it's those sort of things like the care and care that Richard mentioned, the things that are happening and how we can actually get behind them and actually put pressure on actually to make them work. So Claire, hi, nice to see you.
Morning, everyone. Thanks for bringing me in. Yeah, it's just a really interesting thing, and lifetime homes in particular, having previously been a sustainability manager for a local construction company, the difference you see in those homes is just fantastic. And I've always struggled why these haven't kind of been been mandatory to have. And I think with the future home standard, which is obviously still going through consultation, I think there's an opportunity there in kind of improve what we're doing. But I agree, and I can't remember who it was that said about GM being that leader, and I think there's a massive opportunity for Greater Manchester to just say, look, we recognise we've got this issue, we want to do something about it, and to really kind of push forward on that. There are lots of small scale examples that are just fabulous, and I've suggested to Charlie about Seven Construction. I was kind of lucky enough to work on a scheme that was it was a silver lifetimes home, just near the McDonald's in Lower Broughton, which has a certain irony to it anyway. So there are examples, and I think that's singing what we're doing and then saying, this is what we would like and what we would expect. I think will help build that momentum and hopefully then see that we can kind of try and push through those things as well.
Well, thanks very much for that. I'm just going to sort of reflect on where we are, but just to go round back to the panel. Steve's had to go off, unfortunately, but I think we've got a good enough team if they're to really sort of go back and sort of think from this conversation. I'm just going to put it out there, and I think we may have all hopefully different views, but if there's one thing the government or Greater Manchester should do differently or could do differently now, looking at that long-term need, or is doing now, I mean, what would that be? What would be your wish list, whether it is Rishi Sunak or Andy Burnham or Sajid Javid or all of those things? It's just sort of like, how do we actually capture this real opportunity to sort of bang the drum and say this is a really important issue? There are things that you could do really easily now, and it isn't too difficult. So I know that's a very broad and rambling question, but I think hopefully you'll understand what I'm trying to get at. I'm going to bring in Lord Best because he'll have the answer.
Well, just to pick up on the 1 or 2 points, the lifetime homes point, and we've got this consultation. Will we get Part M42, which sounds like a motorway, but this is the building regs that could be changed to achieve more or less the lifetime home standards. You know, the Greater London Authority has already gone ahead and does require, in effect, lifetime homes within Greater London, and I would urge Greater Manchester to do the same. I'm not absolutely sure on their legislative position, but insisting on those standards pays huge dividends in the long term. Homes that are suitable for everybody, better for everybody. And because all the house builders have got a level playing field, they've all got to do the same thing. They always have a good moan at any raising of standards, of course, but it applies to all of them equally. So competition-wise, that's fine. They'll just get used to it and quickly adapt if they have to. So I think, you know, insisting on what in effect are the lifetime home standards, if government doesn't do the right thing, I was rather hoping that we get a quick answer. There seemed to be a bit of momentum going for upgrading, but it's gone a bit quiet, and I'm a bit suspicious of this. So we're going to get an announcement on a late Friday evening or something. This may not be good news. Just in terms of what's going to happen to social care, I do hope that during the, when this integrated care bill is debated, that housing gets a good innings too, because integrating the housing element always gets forgotten. So can we have a go at that? What I suspect government's going to do on the really big question of future funding for social care, I mean, my political colleagues would be more astute than me on this, but I think what they'll probably do is go for a bit of dill knot. And say we're going to do a longer term review. This is another can kicking exercise. We're not going to, we'll just, this is heading off the catastrophe for people. Dill knot says you only have to pay up to X. And I think government will buy into that. So it'll cost a certain amount, but it won't cost too much. And they'll be content with that if we're not careful. There might be throw out a little bit more cash for social care in the settlement for local authorities just to stave off, but it'll be another postponement. That's my guess, rather unkindly. But just one last thing from me, Gill. We did in the Affordable Housing Commission, we did suggest this National Housing Conversion Fund, which is about the acquisition of existing properties that are unsatisfactory and doing them up and then keeping them in social ownership. We've got to accelerate the switch back to social housing from the private rented sector. We've gone far too far in expanding the private. It's gone far beyond its own capability, and it's expected to do far more things than it knows that it could possibly do. So we have to rein back, and we could speed that up, accelerate that, if some of the funding for the Affordable Homes Programme was available to acquire existing property from private landlords, convert it into better homes and into social housing where people get some security and lower rents. And that in Greater London, 10% of the GLA's funding, which is about 4 billion for the next few years, 10% is available for non-new build stuff, the acquisition of existing. And I think Manchester ought to, just have a good look at that. Some work, I know probably Charlie is doing all the right things. Some people are already on the case, but it's back to the future. It's where the housing associations, 50 years ago or whatever, came in and were doing great work, upgrading streets by getting to work on a handful of houses that then encouraged everybody else to get going as well. But that can produce relief for the elderly occupiers of particularly privately rented properties that's down at heel. And I would just commend that idea. Thank you, Gill.
Yeah, that's brilliant. And on the point of unlocking, I mean, and also your wish, Charlie, I just thought it might be good now to go back to you and just have your sort of thoughts on today about what can be done, because obviously the whole thing is that you can get on with certain things, but there are barriers in the way, obviously, but let's see what we can do. I mean, Charlie.
Thank you, and I agree with that, Richard, that we need to make best use of the existing homes that we've got, and that can mean acquiring properties on the open market and converting them for use. It's a lot quicker as well to do that, and we are doing lots of that. So I think my ask would be, we need to stop kicking this can down the road. We've just got to, and this cuts across everything, doesn't it? And it can affect any one of us, as you've said, Gill, in our lives, or we might know people, whether they've got a learning disability or a young person, or we're all going to age, aren't we? So, and I think this needs proper long-term cross-party support and longer-term commissioning support, and we just need to get over ourselves about it, don't we? Because it's about treating people with dignity, as a lot of people have said today, and we need to address it now and stop kicking the can down the road. Specifically, I would say that we need to support and protect those pots of money that are there to support individuals, whether it's with mental health needs or learning disability needs, and not let them be at the behest of local authority budget cuts, because local authorities haven't got any choice. We need to ring fence those costs, because at the end of the day, they save money for the public purse in the long term, and also give the best outcomes and independence for people. And then I would say, if I can cheekily ask for another one, it's about the higher grant rates for grants that are available, coupled with giving land free or at a decent price to get new schemes built. That will go a long way to help the housing providers to actually deliver these schemes, because there's so many barriers in the way at the moment. But you can see it's almost like it's so obvious what needs to be done, and we just need to unlock it and unlock the barriers. So, and the appetite is there, and the coalition of the willing is certainly there in Greater Manchester. Thank you.
Absolutely. And then we're going to go to our two Greater Manchester parliamentarians. I'll go to you first, Andrew, and then I'll end up with Barbara in terms of wishes and asks, what we should be doing.
So wishes and asks, one at a local level for Greater Manchester is to have a very firm requirement in the Places for Everyone strategy that replaces the Greater Manchester Spatial Framework, that for every piece of green belt that is taken for development, taking on Lord Best's idea earlier, there should be a requirement in that document for lifetime homes and homes for independent care and independent living. So that's something for Greater Manchester. They can do it. That's the quid pro quo for taking Greenbelt. We have homes for everyone, literally, and that's, I think, is a reasonable ask. And then for government, we need money for social care, and we need to ensure that the innovation, where it's happened, bringing health, social care and housing together, is not dismantled by any future reorganisation. Actually, we build on that innovation, we build on that integration, and we make sure that housing is part of that jigsaw as well, because Nye Bevan's wish was that housing and health were linked, and they should be, because they are.
Fantastic. And as always, we're in violent agreement, but you know, there's so much here, and it just makes sense, doesn't it? Anyway, Barbara.
Thanks. Well, I think this has been a really worthwhile session, Jill, because, you know, it's quite clear across the panel that we do understand the issues. Yeah. What we have to do is prioritise the solutions and keep pushing them onto the agenda, I think. And I think what the numbers that Charlie put into the chat, I'll read them out. That we need 7,800 new ageing well homes, 1,400 learning disability schemes, 2,535 homes for people with mental health needs. That's, you know, we understand that, but we have to have the mechanism for you know, for making sure that happens, and that's what's been lacking, really. So as Andrew says, you know, as the planning changes to go ahead, and you know, I mourn every piece of Greenbelt land the same way that Andrew does. I know he and I both fight like anything to keep hold of Greenbelt, but there has to be that requirement for lifetime homes and supported living. And in terms of government, yes, we do need the money for social care, but I think we need to say very loud and clear. I mean, I agree with Lord Best. I think it's quite likely that there might be some kind of fudge of just bringing in Gill not to cap care costs, but that's not enough, because I go back to what I said earlier. We've got to, it's not enough because it's not developing the supportive social care services that would enable people to live in their own homes. We've got to argue for that. I mean, interestingly, there is quite a consensus already across Parliament, you know, in both the Commons and the Lords, there's quite a consensus about this. You know, the Economic Affairs Committee in the Lords came up with, you know, with a report that we could have produced in the Commons. You know, we all agreed it. So we can't really accept, you know, I'll do another consultation, kicking the can down the road again. We can't, because we already have a degree of consensus. We know what needs to be done. We just need to argue for it and keep insisting that it happens.
Yeah, so excellent points. And I think that whole thing about can kicking, you know, has got to stop. This is my view, it's that this is an opportunity, and there is that consensus. You know, one of the other campaigns we run is the Future Social Care Coalition. That's very much focused on the need to reform a workforce, but also that there needs to be reform, and that is cross-party, and it brings Jeremy Hunt and you know, everybody together, former social care ministers and health ministers. And you know, I think if we can actually sort of keep going on that economic sense point, you know, Gill not is too difficult for Conservatives to get their head around. But it's not, as you say, as we've all said, that isn't the solution. That's not what we're talking about here today. We're talking about a much bigger, you know, issue that needs to be tackled. And it is a, you know, and it's an issue which was going to get worse because of the pandemic moving forward. And government need to see that as an emergency as much as it does the climate emergency. In my view, they're linked, but you know, we've had a great conversation today, and I think you know, I hopefully we'll all feel inspired to carry on and champion this really important policy area. And also, you know, we've talked around, you know, good ideas, you know, from, it's not just about money, but yeah, it would be, you know, unlocking some of the things that are working. We talked about some of the innovation that's going on. We've talked, I think if we did a word cloud, long term would probably be there in the big figure, but also lifetime, you know, that's cropped up again and again. But the words I want us to go back and think about is that there is a need for collaboration, there is consensus, and there is ability to move forward on this. And also to put, you know, our next and final session in this series will be around places for everyone, or time to do that, but it is around the delivery and bringing that thought process, and a little bit of the GMSF will come into that. But I think one of the points that hopefully has been clear today is that social care and supported housing has got to be very much part of places for everyone, and we can all get behind that. And we can, Greater Manchester, again, being an exemplar. I mean, it's just so much common sense, as always, been talked. It's you know, very frustrating for all of us as well, that we really need to push government on this, I think, and with Greater Homes for Greater Manchester working with the GMCA and all the other people involved, hopefully we can get that voice through. Now, I think I've chaired this session excellently because it's 11:29 and we're coming to an end. I think we've probably got one. No, thank you, Matt, thank you for the discussion. But lots of good things in the idea. I think the idea of doing some visits would be really good to look at what we're doing, and that might be something we've asked the Chartered Institute of Housing, that we might do that in their conference in Manchester as well. So there's lots going on. So can I just finish by saying we haven't got the date for the final session because it does depend on when the consultation process starts, but it's coming soon, and hopefully see you again. And I just wanted to thank Charlie As always, thank you so much for your contribution, and Richard, Andrew and Barbara, and of course Steve, who had to go and interview somebody. But you've been a fantastic panel, and let's keep working together. All right, thank you everyone.
Thanks, Jill. Thanks everyone. Bye. Bye.
Bye-bye.